Yoga means union and Nidra means sleep. So Yoga Nidra is also known as yogic sleep. It is a powerful practice that brings the body into a deep state of sleep while maintaining awareness. So this is why it's also called non-sleep deep rest. So let's go over the physiology of sleep so you can appreciate what is happening during Yoga Nidra. So sleep is not a passive state. It's an active, complex process that restores our body. It unfolds in repeating cycles throughout the night, made up of two major types of sleep. So non-rapid eye movement sleep and rapid eye movement sleep. Each stage serves a specific purpose in our physical and mental recovery. So let's walk through them. So when we are awake and we have active beta brainwaves that are very frequent, okay? And so this is when we're critically thinking. And so when we start to close our eyes or get drowsy, the waves start to get a little bit slower and they kind of look like this. This can even happen when we just simply close our eyes. So stage 1 of sleep is light sleep, or the transition stage. This is the bridge between wakefulness and sleep, which lasts just a few minutes. So brain waves are now starting to get slower from alpha to theta, like that. So muscles begin to relax. You might feel a sudden jerk or sensation of falling. This sometimes can happen even when you practice Yoga Nidra. Breathing and heart rate begin to slow. It's easy to wake someone up during this stage. So your brain is just beginning to disengage from the outside world. So stage 2, sleep, this is where we spend a lot of our time, the largest portion of our sleep. There's a lot of memory processing happening here, body temperature starting to drop a little bit more, heart rate and breathing are slowing further, the muscles continue to relax, your body is starting to power down, and the brain is starting to sort through the information gathered during the day. Stage 3, which is deep sleep, which is also known as slow wave sleep. So you can see that by how slow the waves are getting, okay? This is the most physically restorative phase of sleep. Now brain waves are delta, the muscles are deeply relaxed, blood pressure and heart rate are down, breathing is at its lowest. It's hard to wake someone up during this stage. So this is when tissues repair, muscle growth is happening, growth hormone is secreted, immune function is restoring, detoxification is taking place. Stage 4 is rapid eye movement sleep. This is where the magic of like dreaming happens. So brain activity actually speeds up almost like you're awake. So eyes are moving rapidly under closed eyelids, hence the name. So muscles are paralyzed, preventing you from acting out your dreams. Heart rate, breathing become irregular. REM supports emotional regulation, memory consolidation, and learning, especially for creativity and problem solving. So a typical night of sleep includes 4 to 6 cycles of moving through these stages, each lasting about 90 to 120 minutes. So the night starts with more deep sleep, and as the night progresses, we move into more periods of REM. And then the shorter the deep sleep happens. So both of these types of sleep are essential. You need all of them for full recovery. Because Yoga Nidra can help with creativity and learning, you can try using it either before needing to create something or after you learn something to help consolidate the information in your brain. So in your brain, you have a map of the body of both the sensory and motor cortexes called the homunculus. There is a diagram of this in the resources so you can have a visual of it. Oftentimes when we are in chronic adaptation to stress, our awareness of certain body parts becomes either hypersensitive or hyposensitive. So this alters the blood flow, the nerve conduction, the lymph flow in that area. So how Yoga Nidra helps is that there are body awareness techniques that are guided bilaterally throughout the whole body to bring attention to the breath to all of these areas. So you will notice there's some movement or tension techniques coupled with relaxation to help reteach the system what a sympathetic and a parasympathetic tone in the body is. So this helps to strengthen the brain-body connection, which ultimately builds safety within your system. This eventually over time strengthens your adaptability and your physiology for greater health and vitality. So remember the hand model of the brain. This represents your brain. Your spine here, this is your spine, your survival responses, heart rate, breathing. Your thumb inside is the limbic system, or the emotional system, emotions, memory, fight, flight, freeze responses. And then your fingers folded over is the prefrontal cortex, which is right about here. Your thinking, decision making, self-regulation. So when we are letting the limbic system, which a portion of the brain, the amygdala, is a part of, we have very little control over our physiology. And when we practice Yoga Nidra, this prefrontal cortex comes back on board. So the yogis say 11 hours of consistent practice helps restore this function. The yogis also said that a 30 to 40 minute practice of Yoga Nidra is equivalent to 3 to 4 hours of sleep. So this is not to give you permission to skimp on regular sleep. Yoga Nidra is meant to be done in addition to sleep, but it does demonstrate how powerful it is.